going. First of Ramadan, subhanAllah, let's make every moment count, because before we know it, the days will fly. And we're actually talking about a topic beyond medicine. Can we end TB without fixing poverty? That is the big question. And we're tackling an issue that many think belongs to the past, but it's still very much a present reality in our communities, and that is tuberculosis. TB is not just a medical condition, it is deeply tied to poverty, nutrition, employment, and policy. But there's another layer. Malnutrition significantly weakens the immune system, making individuals far more vulnerable to developing active, basically. So joining us for this very important topic and for us to understand it, we are joined now by our guest on the screens and the airwaves of Razia Rangrage, Rural Health Advocacy Project Executive Director Razia Rangrage. Good morning and welcome to Radio Al-Ansar, an Urban Woman.
Assalamu alaikum and Karim to the community as you go through this very important time. And thank you for the opportunity for us to share them in the reflections with you today.
Alaikum salam. Jazakallah khair for that. And Allahumma ameen. We're talking about something so important. Share with us, how does tuberculosis affect a person's ability to work and to also earn an income?
Look, it's a notifiable disease, right? So when you are contracting tuberculosis and the symptoms like shortness of breath, rapid weight loss, persistent cough, night sweats, and the like start manifesting, it can have an impact on your employment because you're required, obviously, to isolate, start on TB treatment, and then re-engage in the working system. So, and it's one of the things that contribute to people not wanting to test for tuberculosis is that loss of income. We know there's been a lot of conversation around poverty and hunger in South Africa. And it's important to note that the Bureau of Marketing Research, as well as a study from the University of Cape Town, recently confirmed that 75% of working people in South Africa earn less than 6,000 rand a month, right? So really the struggle is real, both for people unemployed and don't have pathways to employment, as well as those active in the economy to stay afloat. And all of these things contribute to weakened immune systems, delayed responses to healthcare priorities that are treatable like tuberculosis, but it also requires a whole system approach to addressing the broader determinants of health, and nutrition is central to that.
Absolutely. Nutrition is central. So many factors come into play, and once there's stress, then you can't allow your body to heal, because definitely it can be treated if caught at the right time. How does malnutrition then increase the risk of developing TB?
Look, I think it's really about staying on the treatment more than anything else, right? Malnutrition's weakened. I think in South Africa we've got like quadruple epidemics, right? And if we add the fifth one, epidemic of poverty, all of these things contribute to poorer health outcomes. So firstly, nutrition has a very important role to play in early childhood development, right? So if you don't receive a balanced, nutritious diet, it does impact brain development, contributes to stunting. And there's one of the issues that the president raised, and we're very happy that he acknowledged, the importance of the determinants of health in broader development. So nutrition and stunting is the first place where it manifests. And underdevelopment also leads to lower economic productivity later on in the cycle. And tuberculosis is one of those diseases where economic vulnerability tracks with tuberculosis infection and so forth, particularly in a country like ours where most of us actually have latent TB. But as when our immune systems deteriorate, sometimes through not having enough food, being in very difficult conditions, it creates an environment for TB to be activated, right? And a large part of the 250,000 cases or so of people who acquire TB each year is driven by that.
Wow. How sad. How sad to know that something as like TB can actually be avoided if we can just combat that poverty cycle. Why are health taxes considered both a public health tool and a revenue strategy? We go deeper into that.
Yeah, so obviously that's looking at the broader enabling environment. We know, for instance, that we have a long history of excise taxes on harmful products. They have a health impact. We saw in COVID, for instance, what the impact is of alcohol on trauma and trauma-related cases in hospitals. It costs us a lot of money. It was the first time that we got a window just how big that cost is. And it's something that we need to build out. So, excessive alcohol consumption contributes to trauma, interpersonal violence, which is the leading cause of death amongst young men across the country between 15
Right.
and 20, is interpersonal violence, often driven by alcohol abuse, road
Mm.
accidents, the list goes on and on. And what we raise in taxes is really disproportionate to the public health impact, right? So raising taxes on alcohol, particularly beer, which makes up 72% of alcohol sales, provides an opportunity to generate revenue in the short term, reduce demand, and at the same time start building a healthy society. The same
Hmm.
thing with, we raise 18 billion rand from tobacco each year, based on information that they put into the tobacco amendment bill. The
Uh-huh.
economic impact of tobacco can be as much as 48 billion on the health system annually. So we get 18, but it costs us 48 billion in costs related to tobacco, like cancers, hypertension, cardiovascular. Almost every single health condition is worsened by tobacco. And actually they were the most successful taxes so far. We introduced them in the 2000s. For a number of years, they contributed to a reduction in the incidence of new smoking. Right now, unfortunately, with vapes, we've normalized smoking again, and that
Yeah.
incidence of smoking is rising. So now we need to look at the taxes again. And I think the last one around sugar sweetened beverages. You know,
Mm.
um, yeah, having a drink now and then is okay, but we excessive abuse of it, and the prevalence of cheap sugar sweetened beverages. You can buy 2 liter for 10 rand, right?
Yeah.
And excessive consumption of that is also bad for your health because it contributes to greater risks for contracting diabetes, type 2 diabetes. And for many of us, that's still fresh in our memories. I mean, the leading comorbidity during COVID, particularly in the third
Hmm.
wave, was
Hmm.
diabetes, or untreated diabetes. So now, as we sit on this cusp of lots of innovation, HIV prevention medications, and the like, we also, it's accompanied by economic slowdown, right? Where the state's ability to respond to all of these things is constrained by the taxes that it raises. So health taxes present an opportunity for targeted intervention. It only affects the people that consume those products. It raises the price and it reduces the risk. And in a sense, it's neutral, right? Now, nothing is ever neutral because I'm sure you'll get arguments on the other side. But from our end, we have to look at the
Yeah.
greater. As we raise more money through those taxes, we can invest them in strengthening how our system responds to things like poverty and hunger. And we're doing a lot. For the school feeding program is one of a landmark successes, but it's not universal,
Mm.
right? So it's only for qualifying kids. So sometimes indirectly it creates a stigma where the children don't go into that queue. And I think this is one of the interventions we should universalize. Everybody
Yes.
gets a meal. And by doing that, we change how people eat, right? And the kinds of meals that we present and so forth. So, yeah, we're not without options to respond as a community. I think we just have to look at the tools that we have and the extent to which they respond to the reality that we're in today.
Wonderfully explained, and you put so much into perspective. And those digits that you mentioned, they are wow. Then the negative spin off that happens, and how we just stay in that cycle and we recreate this, the situation that we are in. But yes, there are tools, as you mentioned. Now, if we truly want to end TB, Russell, do we need to actually address the economic vulnerability as much as medical treatment? What would you say?
Well, I think it's a balance of both. Like the global north defeated TB primarily with improved housing and
Hmm.
economic. So rising tides lift all boats. The richer we become, the riskier risk TB becomes. But that doesn't take away the fact from where we are now, right? People need care. We've made significant results. Obviously, HIV and TB in South Africa work together. Over the last 10, 15 years, as we've responded better to the HIV response with increased access to medication and the like, we saw TB incidences drop. So incidence is the rate at which new infections grow in
Hmm.
a particular. So since between 2015, we're using 2015 as a baseline,
Right.
up to 2024, we more than halved the amount of people contracting TB. Right? So I think that's a
Fantastic.
good story. But we still have
Absolutely.
150,000 people who contracted. We still have 56,000 people who die from this curable disease. And I think the path now is a medical path, right? Along with broader social assistance. So we've got a campaign that we're working on. I coincidentally co-chair a TB technical task team. And we're starting off with the promise of saying, firstly, if you want to end TB, you have to find TB, right? So we've supported an ambitious campaign to expand TB testing so that we can find those who have TB, living with TB, treat them. And the data is beginning to tell us that we need to start looking at different ways. You know, one of the big things that we know, for instance, from the data that we've seen, that across the country, not enough men are testing, right?
Oh.
And amongst the men that we do test, they have a
Mm-hmm.
higher percentage or we have a higher yield of positive cases. So what that
Wow.
says, we need to double down on differentiated testing strategies. That's the
Mm.
first. But we also help with technology. Over the next year, we will be testing a new diagnostic tool that takes TB out of the testing out of the clinic and brings it closer to where the communities are, right? And I think so
Wonderful.
that's another tool that we can bring up in
Yeah,
the
because
long.
people don't really have the time to also go out, so take it there to them, make it much more
Imagine
accessible.
like
And
going to your Discam or your Clicks or even the community pharmacy who can now also initiate you on life-saving ART and get your TB test. You
thank you
know,
so much.
yeah, there's so much opportunity.
Absolutely. Well, that's great. And you know what? Despite the numbers and what we spoke about, and we know how TB, if you're not treated, it can be so detrimental and life-threatening as well. Education is always power. We thank you for your time. Due to the time, we're going to have to wrap up here. It's time for the 11 a.m. news. Once again, we wish you a lovely day further, and thank you for sharing all of this information and also sharing hope that those numbers actually came down. So continue with that, the strategies, putting them in place, and look forward to a positive South Africa with regards to TB and going forward health-wise. Until then, have yourself a lovely day further, and bye for now. And let's go for the 11 a.m. news. That was Russell.